Welcome to our suicide prevention basics section of our mini series. We'll run this every Tuesday for 15 minutes from 12 to 12:15. We hope this just gives you a chance to learn a little bit about suicide prevention. And we'll just jump right in since it's going to be just a short, quick minute. Couple logistics. If you have questions or feedback, you can pop them in the chat. And because you're all muted, and we'll answer questions at the end. We'll give a few minutes. So my name is Molly Signoretty. I am a population health consultant here at GBS, and I work on our consulting team, but I also head up teaching our QPR, which is a suicide prevention training. So this is a fun area for me to present on. What we're going to cover essentially in this quick 15 minutes is how do we use appropriate language when we talk about suicide prevention? What kind of warning signs are there for suicide? And then how do we respond to that concern if we do see a warning sign in someone we know? So the way that we talk about suicide really kind of sets the tone for allowing people to feel like they can share and be open with sharing their struggles with others. So when we talk about it, there are a few kind of key pieces that we focus on. We want to avoid saying things like successful or completed suicide. So that's going to be this orange side of this chart. That essentially indicates that it was some kind of success, or we've checked a box, or we've completed a task. So instead, we want to say things like died by suicide. So we say, instead of completed, we would say Sally died by suicide or Bob died by suicide. It just shifts that language to more of a statement versus some kind of accomplishment. We also want to shy away from saying things like unsuccessful suicide or failed suicide. Similar to the completed, this says that it's some kind of accomplishment or a completion of a project. We don't want to associate those things as a positive. So instead we say they survived their attempt. So Sally survived her attempt, Fred survived his attempt, and that being the positive phrase. Committed suicide indicates some kind of crime or sin. And again, we're going to refrain from saying things like that. And we say died by suicide or took their own life. The last one here is that Kelsey is suicidal. This essentially highlights just the focus of those key pieces of her thoughts. And anyone who's having, a mental health concern or a mental health issue is more than just those particular feelings in that moment of struggle. So instead, we say things like Kelsey has had or is having suicidal thoughts. Just as if we talk about a physical ailment, we don't say things like Kelsey is cancer. We say Kelsey has cancer or Kelsey is experiencing cancer, and just making sure we're making those shifts. So these particular changes can really help the way that you talk about suicide and making sure that you are, providing an open means of communication for others who might be struggling. This is something that takes, a while to definitely shift. But as we walk through mental health, we can definitely make those shifts and efforts as individuals to work on language. Warning signs of suicide. There's not one particular sign. Something I always like to emphasize with suicide is that suicide is not the key issue we're focusing on. And what I mean by that is essentially the thought of suicide or having thoughts of suicide are the result of some other kind of, mental health issue or unrelenting stress in life. And suicide is essentially how those individuals feel they may, escape. It's not the core of the problem. We're not solving for suicide. We might be solving for, depression or another mental health issue, but keeping that in mind when we're thinking about the warning signs of suicide. All right, give me a second. My screen is slow to change. So warning signs can be shared in a number of ways. Something that's always emphasized with suicide is people are often pretty open if they are experiencing a crisis, where they are pretty verbal in a lot of cases and saying, I may commit suicide, or I would like to end my life. I'm hoping I don't wake up. So listening for signs of that. There's essentially four different areas where we look at suicidal behaviors or things that would cause red flags. And so any of these or a combination of them would cause a pause in you to basically say, Sally might need some extra support. I should check in with this friend. They're showing some odd behaviors, but essentially any combination of these should cause you to pause and respond to this individual because they may be struggling. The first is that talk. They openly communicate that they are, whether they're struggling or they tell you they're directly that they're going to commit suicide or that they, just kind of hint at it. Those things would cause us to pause and say, hey, I need to really check in with this person to make sure that they're doing okay. They might be struggling. Behavior is another one that would cause us to, take that pause and be concerned. So an individual who might be, giving away prized possessions at an odd time, or maybe they are drinking heavily when they haven't in the past. Maybe they're, going to church all of a sudden, or they've dropped out of their, faith. Either of those can be indications. So just things that are really out of the normal for that individual. So maybe you have someone who's really happy go lucky and suddenly they are raging, flying off the handle, those kind of behaviors that would be really abnormal for them. Those would cause us again to just have that red flag and say, something might be going on here. I should really check in. Life events are another one. This is one where, there's 100 different life events that could happen to kind of send someone over the edge, but things like, the loss of a child or a spouse, especially, if that loss is also to suicide, things like the loss of a job or unexpected financial loss. In some cases, loss of freedom. So that looks like incarceration, or loss of independence. So maybe, an older adult is moving into a home where they have more care and that feels like a loss of independence. So, right, there's a number of different life events that can kind of send us over the edge, and making sure that we have support in those times. Those who are struggling with that may show other signs like behavior, or talk after these type of events, and any combination of that would definitely send us to making sure that they're okay. The last is mood. So, Kelsey or Sally, who we used in the previous example, might, have lost a spouse and suddenly their mood is the opposite of what it used to be. They're really seeming, whether it be really outgoing or really closed off, those types of things, those would cause us to pause. So again, we're not solving for suicide. We're essentially solving for a combination of other, life circumstances that's making this individual feel as if that's the answer. And so making sure that we're just listening when our friends or our coworkers or our family speak and checking in with them, making sure that if you notice odd behaviors or you notice odd encounters, that you check in with them. So we'll go through kind of an example. We'll use, Kelsey as she's listed in the language piece. Kelsey, maybe she's lost her spouse and she starts to show signs of anger or depression, and she's drinking heavily, and that's abnormal for her. What do we do? What does that mean? So in that step, how do we respond to this? So we've noticed some odd behaviors in Kelsey. Maybe she's our friend, maybe she's our coworker. What do we do and how do we respond? So don't wait. That's kind of the biggest piece, is essentially if you're noticing these behaviors, making sure that you're taking action immediately is a key piece. And then making sure you're providing a judgment-free and safe zone for Kelsey to share. And what that looks like is making sure that you have your phone put away. You've chosen to have the conversation in a private spot, and given plenty of time for her to really open up and share with you. And then allowing her to, speak freely. So maybe this conversation sounds like, hey, Kelsey, I've noticed after your partner died that you seemed really withdrawn and, you're drinking more than normal. Is everything okay? Are you thinking of suicide? Are are there other, struggles you're going through, and allowing her to purely then share what she's experiencing. Again, judgment free in that space. Kelsey may choose, to share. Maybe she is thinking of suicide, or maybe she's really struggling with depression and she needs extra support. So we can respond with how she shares with things like, I care about you and I would like to help you. Making sure that you're validating their feelings. This can be really hard to talk about. Thanks for being open with me. I'm so glad you told me. Things that essentially reassure her that what she shared you care about and you're validating her feelings. That does not mean you have to agree or have been through the same things, but making sure that you're validating how they're feeling. The last piece of them is making sure that we're then getting individuals connected to resources that can be helpful in those conversations. So if Kelsey does share in that conversation that she is thinking of suicide, we want to make sure we get her connected to someone that can help, because most of us are not mental health care professionals, and that is completely fine. But how do we get her connected to someone that can take it a step beyond? So the resource essentially I'm going to talk about today will get us connected to all of the suicide resources. About, I think, 3.5 years ago now, basically the National Suicide Lifeline has come about. Prior to that, we had individual state lines, which we still have. So maybe you're in Utah or Colorado, Idaho, all of your current hotlines will still work, but there's a national lifeline, and that basically operates very similar to 911, where you call and they dispatch you to local resources. But this just allows you an easy number to remember where all the resources are kind of sourced together. So if you have your phone handy, I encourage you to take it out and just program 988 in right now. That is the Suicide Crisis Lifeline. And it is available 365 days a year in all 50 states. And what happens when you call, so as we'll continue walking through our Kelsey example, is Kelsey shared with you, she's having suicidal thoughts. You say, hey, let's call the lifeline and get you connected to some resources that can help de-escalate the situation and make sure that you're taking some next steps to get the help you need. So we call 988 together, and a trained crisis worker will answer the phone. So someone beyond our scope, and they can essentially help assess the situation and figure out the best step for this individual. So maybe it's local care, maybe it's simply making sure that they get connected with, an emergency session with their therapist. There's a ton of different pieces that go into that. So this is one I encourage everyone to save in their phone and just have handy. So that's a great example with Kelsey of walking through, kind of that process, how we talk about it, what kind of signs we see, and then how we respond to that concern. Again, the resources are excellent. For today, that's essentially the rest of the content. Next week, however, we're going to talk about safe messaging. We have a guest on who will run through essentially how to safely share about suicide prevention or share stories of hope. Because again, this is, how we talk about suicide is very important. And so she'll walk through essentially the pieces of how do we share on social media? What kind of content do we share that essentially is helpful versus hindering someone? So join us next week. Thank you so much for jumping on. If you have questions, I'll stay on for a few minutes and you can pop them in the chat. But I really appreciate everyone that came on. I hope you have a wonderful rest of your Tuesday.